Today I'm going to demonstrate oral care for someone who is tube fed, someone who does not eat by mouth. So GJ tube or a G tube. I'm going to use a variety of different suction tips. So the first one is this spongy brush. It's just got a sponge on the end and it has the suction, the controllable valve right here. So you put your thumb on there, it's suctioning, you take your thumb off and it's not. So I'll dip this in a little cap of solution of chlorhexidine. This is an antibiotic rinse you can get from your dentist. So I just put a little bit of that rinse in the cap of there and then just soak it up. When I turn on the unit, I can insert the sponge and just start in circular motions, and on and off I'm suctioning. So I'm kind of like on and off with the valve. Circular movements to get all the teeth. I'm gonna kind of do this quickly so I can get to the other sponges that I want to show you, other toothbrushes and oral aids, okay? So there's that. And then I'm gonna show you different kinds. So another tip that I have is a brush tip. So this has a sponge on one side and a brush on the other side. And this sponge is actually, it comes pre-coated with an antiseptic. So I just insert that and it's pretty self-explanatory. The saliva will kind of activate that antiseptic. And then we have a brush on this side. So I'll show you that. So when you brush, you want to use little small circles. Angle the toothbrush towards the gums and just use little small circles. And to get inside the cheek, to get the back teeth, just kind of like use the toothbrush to kind of push the cheek out. And you can kind of retract with your finger a little bit and just get all the way back there with that brush, suctioning on and off. Letting that brush get a little bit, the antiseptic start to get into the solution of the saliva. Kind of brush that all over and then just use those little small circles on the gums. And you can go on the inside too. See, he has an open bite, so it's easy because I don't have to use a bite block or anything. I just kind of like push in with the brush and get his tongue out of the way and then rotate it so I'm brushing here. You can kind of see better on the lower. So I'll push in with the brush, get his tongue out of the way, and just use those little circles. Good. The next one I'm going to show you, the next one, it doesn't have, this is the little sponge lollies. They don't have a suction tip. So with this one, you can use it dry if you're just needing to kind of get some plaque off. You can use it dry and just kind of rub that plaque off. I use this a lot when he has like a buildup of like film when he's sick and he has mucus on his palate. These are good because his palate gets coated in mucus, and it will actually make like really gunk this up, and I like to use this for a full day. So these are single use, and you throw them away when you're done with it. So for this, I'm going to put on my dental tip. So this tip of the suction just fits right in. There's no control valve for it, so it's always suctioning. So I'll use this in one hand and the disposable in the other. And you can soak that in your mouth rinse antiseptic. And I'll just kind of use this to kind of retract his mouth and get this in there. And I like to get this on the palate and spin it. So rotate, I don't know if you can see that, how it's rotating. And I'll just sweep, rotate forward, and it'll get that gunk. And then I'll just wipe it on a tissue or something, and then sweep forward and get that gunk out. And you can get that, you can see I'm actually getting stuff on his tongue. There's a little bit of that gunky, stringy mess. So I'm gonna keep going on that, sweep forward and roll out. If you're gonna get the tongue, see, and I got some right there. So that's that gunky stuff we're trying to get out. And I'll just wipe that on the tissue or a Chucks or a wipe or whatever. And then I'll show you for the tongue, it's a little bit harder because you're gonna swipe the other way. So you're gonna get it in there and then roll forward on the tongue. So get it all the way back there and roll forward on the tongue. And you can swipe that film of bacteria or fungus, whatever is growing in there, and kind of get it out, clean their mouth out, okay? And just make sure they're gonna be stimulated and make a lot of saliva. So just have this one ready. So those are the three kind of tips I wanted to show you. And these you can get in coated in antiseptic or just plain. So there's the single use, the brush and sponge, or just the sponge. The other thing I wanted to show you is if you have a child or a person that doesn't have an open bite, like my son, you can use these foam bite blocks. So this is a soft, semi-soft. It's a little bit spongy, so it's not traumatic for them to bite on. And this is meant to go in without causing trauma, and just kind of wiggling it in little by little. And if you need more space, once you get it in, you can turn it to open their jaw more. For a child, you probably wouldn't even need that if you can just wiggle it back to their jaw joint and kind of pin that open. And then you would hold that with one hand while you suction the other side. So this, as you can see, it opened up the back of his jaw back here. I don't know if you can see that. So if I needed to get to the posterior, he doesn't have teeth back there. They're covered in tissue because he has like eruption cysts. So the teeth are covered in tissue, so there's nothing to clean back there. But if I needed to open it, this is how I would do it. And if you had a grown person sitting in a wheelchair, you can use one hand wrapped around and then use the other hand to clean that side. And then you'd switch to this other side and wedge it back there, and then use this hand to clean that side. So that's that.